Hi friends, welcome back. We're going to talk today about hormones and what some of the common symptoms they can present in pregnancy are. I also really want to make sure that we call out at the beginning of this video that everyone's hormones are different and people are affected by their hormones differently. So when I say common, it is just that these things occur, but that doesn't mean that they occur in everybody or they feel the same in everybody. And people have different thresholds for discomfort. What might be the same symptom in one person, they might have a higher body tolerance for, or like mental and emotional tolerance for than somebody else who might find it like kind of distressing, or it might cause a lot of like tension in different ways for them. So you get to decide whether or not this symptom is tolerable for you, and it's totally up to you whether or not it's something that you want to seek care for. So I just want to put it out there so that we know that some of these things are not a 5-alarm fire, but they're just the body doing what the body does during pregnancy and why. So a couple hormones to be cognizant of are relaxin, which is exactly as it sounds. It's a hormone that's secreted to soften the connective tissue and the muscles, joints, and ligaments that help produce space for pregnancy and for labor and delivery. You might feel hypermobile. You might feel like things are loosening up, or like that pregnancy waddle is really like taking effect, and that is caused by the hormone relaxin. Prolactin helps with stimulating lactation. It also encourages chest tissue growth and development, and it can be also responsible for some mood and anxiety shifts. So again, like for some folks it may like really bother them, or it might really like have an effect on their mood or their anxiety, and for other folks it may not, or it may not be as noticeable to them. So there's also like progesterone, which as well encourages chest tissue development and also softens the connective tissue. It also slows down digestion. So if you're feeling like you're getting a lot of indigestion, heartburn, constipation, it might be because your progesterone levels are really high. Also later in pregnancy, it could just be because like your organs are getting squished, making room for this baby, or it's pushing down on your rectum, and that can be causing pressure that might be discomforting or make you feel like you have to poop. Human placental lactogen shifts metabolism, but may also contribute to gestational diabetes. So it's one to like keep an eye on, especially if you have a family history of gestational diabetes, or if it's really high, it might be a precursor for developing gestational diabetes. And oxytocin. So oxytocin stimulates contractions. It's also the bonding hormone, but it helps to prepare the uterus to get into labor and to stay in labor. It helps baby exit the body. You also have estrogen, testosterone, all of the hormones that maybe like that definitely are already circulating in your body in different levels. And those are kind of like the common ones that everyone knows, but our hormones in our bodies are incredible and do more than I think that we even know or totally understand. There's still a lot of research being done. And hormones are coming from a couple different places in the body. So it really like helps explain why we're having so much change, or why our body's being asked to produce so much because it's coming from our ovaries, our pancreas, our adrenal system, our hypothalamus, our thyroid, our pineal gland, our pituitary glands, our endocrine system. So like the brain, the gut, the ovaries, multiple glands in the body, they're all like kicked up into overdrive in order to make the hormones possible for pregnancy. And our hormones don't actually start to completely like re-regulate until like 6 months after delivery. We have like a taper within that first 3 weeks, which is what we talked about with like kind of the baby blues or some like peaks and valley changes that happen in that like immediate month postpartum. But like it can take quite a long time for our bodies to re-regulate our hormone cycle once we have been pregnant. And so I'm just going to list off some of the discomforts that might be associated with our hormones. I already mentioned hypermobility and feeling wobbly or unstable. We haven't talked about pubic symphysis pain. So there are ligaments that are running down the front of your pelvis. And when we have an increase in hormones, we can get more pubic pain from that stretching, from that growth caused by the relaxin. We can get the intensity of emotions caused by spikes in estrogen and progesterone. We can get changes in blood pressure, dizziness, headaches, and mucus from the increase in blood supply and the increase in hormones that are aimed at stimulating more oxygen moving through the blood into baby, that are carrying more nutrients to and from baby through the placenta. Shortness of breath because baby can start pushing up on the lungs and other organs once baby starts to grow past the second trimester and into the third. Heartburn, indigestion, constipation, pressure in rectum, we've already kind of talked about that. Lightning crotch, which is the technical term is vulvodynia, but it's like a shooting pain in your crotch caused by an increase in hormones. Hemorrhoids and varicose veins caused by increase in estrogen, and also by like putting more pressure on those surface veins, putting more pressure on the rectum in order to poop, progesterone, slowing down that digestion so that more nutrients can be absorbed through the digestive process into the bloodstream and carried to baby. So all of these hormones are doing really, really amazing things. They're really like there for a reason. They're preparing body, they're nourishing baby, but some of the side effects of having an increase of hormones can be kind of unpleasant for some people. Braxton Hicks contractions are caused by a variety of hormones, but also those oxytocin receptors getting warmed up, more oxytocin causing practice contractions so that we can start getting ready, preparing for those big contractions that are going to start moving baby out. Insomnia, that can be caused by hormones. It can also just be caused by the physical discomforts, mental discomforts, emotional discomforts that can come with pregnancy, and especially later in labor when you know that, later in pregnancy when you know that you're about to go into labor. Carpal tunnel is a swelling and discomfort that can oftentimes occur in the hands and wrists. And that is, again, hormonal and oftentimes doesn't resolve once it starts until after baby is out and after those hormones start to re-regulate. So your body is making a lot of shifts, and it's really like sometimes jarring, sometimes creates a lot of tension, is sometimes confusing or alarming. And those shifts can also really affect us like mentally. They can affect our mood. They're sometimes like a physical manifestation of the identity shifts and the stress and anxiety that we are under during this time. And they can also feel really isolating, especially if, you know, you don't know anyone else who's pregnant or going through your experience. And you don't have a lot of people you can talk to and be like, hey, is this normal? Or, oh, feeling like really uncomfortable. And everyone else isn't pregnant and I'm pregnant. So I just feel kind of alone in this experience. So I just wanted to make sure that we had talked through some of this because it can be really, really confusing and really challenging, and every pregnancy is different. Even if you've had pregnancies before, you might experience a symptom that you didn't have in your last pregnancy and have questions about it. And so being armed with like the knowledge of like what some of these hormones are and what some of these discomforts are, and even just like writing them down and being able to like talk to a provider or talk to a support person about them so that you can decide like how you want to move forward. If at any stage during your pregnancy, symptoms become like unmanageable or like scary, there is never any hurt in calling a provider or going in to get attention, because we would much rather have you have someone say like it's nothing than have it be something and you just try to like knuckle it through. And I'm saying that with like full empathy and understanding that sometimes seeking medical providers and medical care, especially as a person who uses drugs, especially as a person who may be houseless or has trauma with the medical industrial complex, it can be harmful and scary in that way. It can be harmful to be experience like stigma or judgment, but hopefully we have support people that we can call in, or folks that can accompany you, or a trusted touchstone that you can pick up the phone and call and ask for support or advice and accompaniment. So let us know any thoughts, feelings, or questions in the comments. And thank you as always for being here. We love you. We're proud of you. This is a lot of information, and I'm so glad that you're on this journey with me. So we'll see you next time.